So, good afternoon, friends. Today, I want to introduce you three very special doctors, all from different parts of India here today, and they all are doing wonderful work. Let me start with Dr. Pramod Tripathi, who is the founder of freedomfromdiabetes.org. And the Freedom FFD has become synonymous with diabetes reversal in India and has already crossed thousands of patients reversing their diabetes, passing their GTP, stopping their insulin, and going on their path of becoming very well. So, welcome, Dr. Pramod. And yeah, the next doctor is Dr. Paawan Wadhawan. Dr. Paawan is a diabetologist, non-interventional cardiologist, and a critical care specialist at Dr. Paawan Center of Diabetes Wellness and Holistic Medicine in Panipat. He's also a licensed acupuncturist, posture instructor in Gokhale method and Alexander method. I also want to tell that he is also practicing what is called as um, food, holistic approach involving food and also meditation techniques. And he is helping many patients reverse their type 2 diabetes and some also type 1 diabetes. And now we have Dr. Arun Kalyansundaram, who is intervention cardiologist from US, who is moved now in Chennai, in Tamil Nadu, and he's an American board certified internal medicine, cardiology, and intervention cardiologist. And he has already published lots of papers in the field of cardiology, and also he has authored some book chapters and books in cardiology. So today, now he is in Chennai and he's at the also in Delhi, he's visiting Fortis Escort Heart Institute. So welcome all the three doctors. I'm very honored. I just did a very short introduction, but today the purpose of us gathering is that I would like each one of you to share your experiences about disease reversal. When I became a doctor, I know that I didn't hear diabetes can get better. But the first time I heard, I said someone is not saying it right. I've given insulin, I've given all this medication. I've been a doctor for so many years. How can that be? And then I didn't leave that. I heard it and I heard it right. I chased the doctor, Dr. Neil Bernard. Who is he? He's written a book. And then it turned out to be a very simple diet approach. And Dr. Neil Bernard came to India and we did many workshops with him and we took down our notes, how he's doing it. And then we Indianized the entire program and started it. And then we were very surprised that some of the patients reversed their diabetes in the first month itself. And then there was no looking back. And that was like more than 12 years ago. And some of our patients are still out of diabetes even since then. So then that's our journey. And now I know this is the truth. This is how it happens. So let's start with Dr. Pramod. Would you like to share how it all happened for you?
So, reversal journey for me started with Dr. Nandita Shah's reversing diabetes program, which was all about veganism. And I think once I saw the program, attended it, it did make logical sense. Just that I was traveling a lot that time, so I asked her, what can I do? Because I was doing a lot of corporate work. So she said, pick up these books and start reading. So I read Dr. Bernard, Dr. Cousin's, China Study, Dr. McDougall, and many others. And it took me 3-4 months to digest the whole thing. And by that time, we had a residential program where Dr. Rupa, myself, and another bunch of 4-5 doctors attended a reversal program in Pondicherry. That was also nice. Then after coming back to Pune, this was all in 2011, 2012. 2013, I started with one simple workshop, and out of those 10, 12 people, one person became free. She's still free, Savita Atwarne. And then did second, third, fourth. So we had around 200 plus people joining in 2013. Um, Largely, the approach was doing a short 2 hour, 3 hour program, and then maybe some hand holding for around 2 to 3 months. Uh, from 2013, 200 people, we moved to around 3,000 plus people joining the programs in 2014. From 2014, 3,000 plus, we moved to around 18,000 people joining the programs in 2015. Okay, programs were happening. I was traveling a lot across Maharashtra, across India also. But I realized that after the program, what? The challenge for the people is okay, they listen to something, they feel inspired, they do it for some time, but it's a very family bound problem. You know, diet is family oriented. You know, if your mother-in-law says no, no, you must take the milk, if your husband counteracts, or if your wife or kids, it becomes very challenging for people to really continue just a diet form. So it took a good 4 or 5 years for us to kind of stabilize the whole program. Now, of course, it's very stable since 2017, 18, I would say. It's a 1 year program we run, and now more than 5,500 people are documented with us on our CRM who are free of medications. Okay, 1,500 plus are free of insulin with their names and entire data. There are many more, some older data we still have to dig out and get it in place. And two research papers have got published. One on nephropathy reversal, 306 cases, very interesting data, and metabolic syndrome. So it's been a phenomenal journey. I see nowadays almost 80% of type 2 going off insulin. I'm talking of data in hundreds, okay? 60% plus or so going off tablets in a matter of, again, 6 months to a year's time. Hypertension, I find the statistics lower, maybe around 12% to 15% going off tablets. Cholesterol is higher. We find around 35% plus people going off cholesterol tablets. In fact, many of them are overdosed with statins at times. And that affects their microalbumin, their TSH scores, their kidney reversal also. Thyroid is the lowest, I would say, because it's largely autoimmune in nature. We find around 4 or 5% going off medications. Weight loss is huge. Latest statistics we have of a gentleman in Gurgaon, 57 kg weight loss. And there are many with 30 kgs weight loss stable for the last 3 years, 4 years. So there are 2,000 plus people who have lost 10 plus kgs of body weight, all documented and kept. So it's been a phenomenal journey on a vegan diet. And what we found is diet is definitely the clincher when you begin the journey, because it's very tangible. Immediately you get the results. But if people remain with the diet, then they miss out on some other parts. They have to progress into reshaping the body through balancing their exercise routine. So diet initiates the reversal. Exercise sustains, I find, the right exercise. And what really encapsulates the reversal is the inner transformation. They need to change from within. Their stress levels have to shift. Their positivity has to come in. Their confidence, their clarity, their wisdom, everything needs to happen. And it's an incremental process. It's not overnight, suddenly things happen over long term. Like, we've got the largest database of people who have cleared glucose tolerance tests maybe in the world, because last year we published data of almost 180 plus people who have cleared GDT. This year we might have more than 250 people clearing glucose tolerance test. Okay, it will be all published online. There'll be a big program on 5th of December. So taking people to that level, it requires some discipline, hand holding, problem solving, support, and stuff like that. So that's been the overall journey, and it's an amazing journey. I mean, I would say we are just learning every day, innovating every day, on technology front, on service front, on people front. A lot of time and energy has gone in developing apps and softwares, and now 120 member team is working with us. So we're able to provide a service for people across 25 countries now. Maybe more than 200 cities people join every month our programs. So that's how it has been. In short, Dr. Rupa and everyone, blessed.
We are like instruments, catalyst in their journey. And it is amazing journey, because what a beautiful smile they give us, Then year on year, they say no diabetes, sugar normal, sugar normal. It's like a new life given to all of them. Wonderful. Dr. Pawan, you're also so many diabetes patients we get there. Videos are also there on internet, some of them type 1 also. You want to share?
Yeah, ma'am, I'm actually finished my MD in 2011, and then I was busy in Ram Manohar Lohia Hospital and JB Pant Hospital, where I did my senior residency in cardiology in JB Pant, and then I was there in Ram Manohar Lohia as a senior resident in the diabetes department.
Hmm.
Uh, we usually in RML Ram Manohar Lohia, the OPD is very heavy. Means we used to see 300 around 300 patients of diabetes per day. And in my 3 years career in RML, none of the patient uh, uh, I started on one medication, it went to two to four to six to means like insulin, and all deteriorated. And my inner exploring mind was searching for something, and then finally somehow by God's grace the vision came into me that there is more to it. And then I started studying the oriental medicine, where I learned acupuncture techniques to stabilize the mind, and then food was the issue with diabetes. And I did research and find out that yes, whole food plant-based diet is something which is exactly which should be given, we all should be eating. And then I explored. My main mentor is Dr. Michael Greger, and then Nandita Shah ma'am, and Dr. Jean Ornish, Dr. John McDougall. I did all the courses from them. Dr. T. Colin Campbell also I joined, and find out that this thing is beautiful. And then the problem came into the reversal of the back issues and cervical issues and joint issues like osteoarthritis. Then I learned, for that I learned Iyengar yoga. I took classes there. I went to US to learn Gokhale method and Alexander technique, and then I brought it to India and I'm using in Panipat, and then learned some meditation techniques from Indian masters like uh, Dandapani is there, and Osho I followed. And finally, I was there in critical care medicine in Panipat, which is one of the famous hospitals in Panipat is Ravindra Hospital, where I was there in critical care, head of ICU from 2013 to 2017. From 2017, I quit everything and I just opened my small center where I started doing my own OPD in my own way. And by God's grace, because my path was right, so the local people started building up. I'm not much involved in social media and not means onto the not too much on the internet, but because my already my local Haryana is pouring on my center, so just simply doing my job and trying to improve the community. And in Haryana, it is little difficult to stop the milk, and but still we are managing it, and we have a huge data. And once things get stabilized, maybe in 2 to 3 years, I am going to come up with a lot of papers. Research is with me, but we have to come on the with time is needed to develop papers.
You want to share some incredible memories of some of the patients that you have helped?
Yes, we have helped a lot of patients in type 2. I mean, like in food, we are doing great with type 2 diabetes. We have a huge success with heart disease and hypertension. Hypertension is my latest research on where I am able to manage quite high BP patients, because recently we have one of the books I read was The Salt Kills by one doctor in US, and we have developed a diet. We are putting people on the rice diet of Dr. Walter Kempner. This diet is something marvelous, and even the chronic kidney disease patients whose BP is around 200, 250, they are getting reversed within 1 to 2 months. Many people have stopped insulin. One person I remember from Calcutta, 100 units of insulin he was on, and he was off the insulin within 1.5 months, which was like surprising for me. Then thyroid also we are taking with, because in thyroid we have found out that the main emotion is agony and anxiety, and we are doing acupuncture, and more than 100 to 150 patients of hypothyroidism we have reversed. Cancer patients I am having right now who are following a diet, only 4 patients are there. One patient of stage 4 prostate cancer, he was told he will be dead by 2016. He's still alive, and his secondaries are there everywhere, but he's stable and eating normal diet. So like that, many people are there, and the journey is good, enjoying simply.
I have seen one of your video where you mentioned that there is no difference between A1 and A2 cow milk.
There is, yeah, yeah, A1 and A2 common, yeah, because in India there is a myth that some New Zealand company came into the picture, and I have proved, you were in my seminars, and in my seminars I have proved that how A1 and A2 both are bad, and how the, because this I teach to my students that uh, always look at the end of the study. All the studies which are published on the A1 and A2 milk, you should go at the end of the study and look at the conflict of the interest, and all are funded by those companies, and all of like, these are biased studies, you should not follow. uh, Means whatever my research is on milk, there was a big controversy in Panipat, because many videos I released, and then some of the videos I have to take back because of some problems came into the our Panipat. But still, people who are following me, simply slowly they are stopping. And plus I have now taken agency of Urban Platter Company milk, and we have opened a small showroom where all we have put some fridges and some vegan products we have brought. So that is going, almond milk the people are liking now here.
Very nice. What a wonderful way of transforming into a belt which is milk loving belt, North
Yeah,
India particularly.
correct.
And to the arguments that ghar ki gai hai, we have a cow at home, A2, why can't we drink that? I totally agree. Dr. Arun, would you like to share with us your journey into plant-based diet and lifestyle, and how it all started with you?
Sure. So, I mean, first of all, thank you so much for inviting me for, you know, for this particular meet, and really appreciate being part of it. And just looking at and hearing Dr. Pramod and Dr. Pawan just talk about their journeys, it's truly inspiring to see the strides that have been made in India in terms of lifestyle management, and like, really trying to make a holistic difference to the patient, and approaching these chronic diseases. So my own journey, I would say, I did most of my training after my med school in the United States, and then I was, in my cardiology program at the Cleveland Clinic, or rather interventional cardiology program, and it was one of these chance things, and I've always been kind of intrigued by how do you prevent this, right? We keep hearing about these, more and more complex procedures, etc., for treating disease, especially heart disease, and so I actually came across Dr. Caldwell Esselstyn, who also is he's in Cleveland Clinic. So, it was really a very, very inspiring figure to me personally, because, here is a person who is, so passionate about the whole thing, and just like having heard his story, and I kind of thought, all right, so this is something that we got to take a little bit more seriously. And so if you my own personal, I can't claim that I have, I don't have a regimented program for inspiring people, or a structured program to get people to go from point A to point B. But what I tell people is this: I do amongst the most complex angioplasties, in the country for sure, and pretty much anywhere globally. And that was one of my big reasons to move back, was to do blockages that nobody else pretty much would do. That's what really gave me the confidence to come back to India, because I'd been I've never worked here. So for me, it was a completely different world. But I tell people this consistently: we don't cure disease. Me putting in a stent, or someone like, you having had bypass surgery, we are not altering the fundamental things. Like, we are not, we're not really curing you of disease. Yes, getting a angioplasty is life-saving in a heart attack, but typically, what people don't realize, and many times, is that differences that they make in their lifestyle, right? That has a much more telling effect on their long-term prognosis. And I mean, whether I would like to kind of say, like, if you look at the 1990 um, study, which I think really was kind of the pivotal one that Dean Ornish published. I think it was in JAMA, which was it's such a great study. And then of course Dr. Esselstein's been kind of publishing his stuff, and Neil Barnard, Dr. Barnard from PCRM is a good friend. So it's like, I mean, they've done a lot of work on diabetes. So I mean, these are things that, so typically for me, it's on a one-on-one basis. So anytime I do any kind of a procedure on a patient, or even when I see them, I'm like, hey, this is really what you should aspire to do. This is what you should be doing. So if you're a smoker, absolutely quit smoking. If you are, you try to get to the gold. I mean, the gold standard, I think, is really a plant-based whole, like, eat real food, like, whether it's Furman's formula or Dr. Esselstyn. Think about, like, don't add any oil, etc. That's the gold standard. That's what you should be pitching towards, and work towards it. And people sometimes, especially when I move back, we have such a disproportionate weightage on. I'm like, I work out, so it's okay for me to eat junk. It's okay for me to do all this stuff. And again, I mean, I think there's this other huge thing, which is the protein myth. Or you're a vegan, how do you get enough protein, etc. So I mean, I think there are a lot of things in play, and I think Dr. Pawan kind of touched upon it. I mean, there are some other forces too, which kind of, there are lots of factors that go into how people make decisions about their life. I mean, you have, some of it is cultural, some of it is like, what your family tells you, some of it is what media kind of, really forces upon you, etc. So my whole take on it is this: look, I look at heart disease, and I'm going to kind of focus on heart disease because you have like two other experts on diabetes. Is really like you've had an accident, and I'm the guy that owns the body shop. So my job is to kind of get you back on track, and then your car or your body is something that you need to be responsible for. So you still got to drive responsibly. You don't drink and drive. You don't drive rashly, et cetera, et cetera. So I mean, and that is critical. There is an overemphasis on medications, et cetera. I mean, I really look at this as a whole pyramid, right? Lifestyle change, the only thing that can happen, and with like virtually no side effect. Yes, it's hard. Yes, it takes some effort on your part, but hey, listen, every medication, you read the back label. Yes, I'm not against medicines, but it does come with some potential side effects. Procedures that we do, right? We always get informed consent so that people understand what they're signing up for. You might be the best interventionist on planet Earth, but I can't make the risk zero. The only thing that you guys, like, as consumers and as patients, that comes at like no side effect is lifestyle change. And there is enough evidence. And I mean, especially, I want to just touch upon this very, very briefly. Endothelial dysfunction that happens, when you are an omnivore or a carnivore, I think it's really telling. And if you look at TMAO, it is critical to understand that, I mean, if you are on a total plant-based diet, you almost don't produce it, and these affect long-term the endothelium, and we need to understand that, these just doing a snapshot procedure or something, unless you change this, you're still at risk for cardiovascular events. And unfortunately, India holds the, we are the diabetic capital, and we also have the largest number of heart disease patients, and these happen at a younger and younger age, in South Asia overall, if you think about it. So we need to realize that patients, I mean, we have the power to change our long-term outcomes. So I'm actually really intrigued, and maybe after this, I would love to like kind of sync up with each of you guys to see if there are programs that we can get people on, because I personally haven't had time to actually develop a program. But hey, why reinvent the wheel if it's already out there? So lifestyle change have a massive yes, for some people, boom, you could say, Doc, I'm going to quit smoking, no more meat, no more oils, and you're going to change. But for a lot of people, take baby steps, like see where you are in the spectrum of change. I kind of many times have an advantage because I catch people in a very vulnerable moment, like when they've had a heart attack, when they've been told that, oh, I have disabling angina, nothing can be done. So for me, it's a spectrum. I do my part, you do your part, because that's the way you're going to kind of be in it for the long term.
Absolutely right. And the problem is that the mainstream medicine knowledge is the mainstream medicine, and everything else is not mainstream. So the knowledge of disease reversal through a simple lifestyle changes is not getting priority. When I was studying to be a medical doctor, that was say 40 years ago, I think pharmacology was difficult subject, and I had to study and remember all those drugs, and there were only three side effects. I was told that write in every drug: nausea, vomiting, diarrhea, if you don't know anything else. But now, in 30, 40 years, I think we have 10 times more medications, the names, the combinations. It has become more complex than even when I was studying. At that time, also, it was quite hard. So, so many drugs, so many diseases, so many perceptions, so many tests. Unfortunately, becoming healthy has become a very complex jargon with multi-speciality, and people are not seeing a holistic approach, a human being with mind, emotions, and body in one individual. And now we can help that person through the lifestyle interventions. Very true. We have come a long way, and we'll have to go back to our basics, I think, simplifying. And the patients just, sometimes they have diabetes for 10 years, and you help them in 2 months. And then they have a huge look on their face. Why didn't my doctor tell me this? For 10 years, I'm taking medication. He never told me this. He never told me anything about lifestyle, diet, nothing. There was a printed chart a dietitian gave, and I just followed, and yet, I never got better. So, our now duty is to tell all our classmates, our colleagues, about all the different research that is available, and how we can carry this further. So, recently I read this story in Times of India with a proper data about the Mumbai Municipal Commissioner had done this data of all the COVID patients in Mumbai, and he showed that 61% of the patients had comorbidity, mainly hypertension, diabetes, and obesity. These were three major. So that tells us to the next step, that all these measures that we do does help in these diseases. We call it as metabolic syndrome X, right? We found a good name for it. Call it as metabolic syndrome X, and that has got PCOD and thyroid and everything is bad, lipid profile, everything is included in it. Fair enough. So, how do we now, use this knowledge in current pandemic situation and show the way to people? But it's been 8 months. The world is waiting for some magic wand or some magic vaccine, which we all know can't be magical unless you have a good immune system. Even a vaccine may not work. You need immune system for some response for your vaccine. So ultimately it still comes down to have a healthy body, and there's no magic drug. If it was there last 8 months, we have seen quite a chaos. So, but we understand that there is a probably two-way possibility by becoming healthy. And there's also another one that is about our close proximity to animals, wild animals, and using them at various levels in our life, either as food or personal belonging. How do we now, move forward in this COVID times? Dr. Pramod.
So I'm in the hotbed of COVID, Pune. I think Pune keeps flashing across the country as one of the biggest numbers of COVID participants. Yeah, and our clinic where it is, you can hear an ambulance moving from that Tripathi Road area every few minutes. So it's definitely not a great state of affairs that is happening. But what I've realized is a few things. Number one is in the last 6 months, we've had hundreds of FFDNs, not only in Pune, but across the country and world, did get COVID. Okay, it came, they saw, and it went away. For all of them, there's been zero morbidity. None of the hundreds of patients of FFD has
That's
had a casualty, and all
very,
of them have,
very good observation. Very good observation.
yeah, all of them have been so profusely thankful for the system, because they all realize that because they were following a healthier plant-based diet and a regular exercise regime with a lot of work on their mind and stress and etc., they were in a much better shape. I guess COVID is going to come and go for many more. It's here for the long run. Just to disclose officially to everybody, even I got COVID. My mother got COVID. My mother is 76 years of age. She's off tablets of diabetes, but sugars can shoot up a bit sometimes. She's been a hypertensive patient. Two of our daughters got COVID. And interestingly, my mother bounced back faster. Okay, my mother bounced back faster out of COVID than me. Um, Thanks to her, again, yoga, which she was doing regularly and following a good diet. Uh, for the last 3 years, she's been regularly exercising. What I've also noticed amongst, again, this needs to be validated from data. People who've been exercising less, look, diet definitely we know it helps you to reverse, but exercising less, obese patients amongst the morbid, I think more data needs to come out. If we can get more data on that, we'll get an understanding of both diet and exercise more. And I feel that both are playing a very, very important role. Right now, we're not having the data of those 61%, whether they were vegans, they were vegetarians, they were non-vegetarians, So a lot more of data needs to come out, and I'm sure we'll learn a lot more with that. So message is very simple. COVID is going to come. It's going to go for most of us. We need to take care of the diet, be basically fitter, stronger, to allow it to go away. As cold goes away, it comes and hits you and goes away. Because one of our office boys got it, and you can't really stop the droplets from doing whatever they do. Okay, beyond a certain limit. We were having all the kadhas which were there for a long period of time, which were very healthy and useful. But if it comes, it's going to come. So just keep yourself fit, eat well, exercise nice, and let it come and go. I mean, till the vaccine comes or what happens. So that's the way I see it. There are some things that we can do during that time if you get COVID, which is helpful. But I guess maybe some other forum we can discuss that. Sure. So zero morbidities, zero mortalities, I would say, zero mortalities in literally hundreds of FFD patients who have undergone the COVID infection. We might have to collect the data. We've tried to send some Google form and get some data and all, but it's really tough to get data, very, 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 very challenging to get all the data. Yeah.
One of the interesting observations that Dr. Shashank Joshi made over here in Mumbai is that some of the patients who had never had diabetes suddenly presented in the hospital with 500 blood sugar, and they were first time diabetic, were actually COVID positive, and they were kept on insulin, and it took almost 10 days to bring down the blood sugar. And when they go back home, maybe they are out of the diabetes for the time being, but it was a very strange presentation of COVID with acute hyperglycemia. So somewhere we have to learn that different strains of virus, one of them is also causing this blood sugar imbalance. Very interesting. Dr. Pawan, you want to share about the current pandemic and what we can do with our knowledge?
Yeah. So since past 5 to 7 years, I am taking seminars all over the India, and I am repeatedly telling people that it is the all the greenhouse effect and this calamities which are now occurring more and more. Like you get now more floods, you get more uh, tsunamis and all this, because it is the reason behind which I am which I was repeatedly telling was that it is not the bio combustion of your fuel. It is not the combustion of your fuels. It is the bio combustion from the animal rearing, which is causing the greenhouse effect everywhere. And now suddenly the COVID came. And it is given on the CDC. If you go to CDC website, they clearly tell that uh, all the viral diseases are always and always zoonotic. They always start from the animals. And we are promoting here whole food plant-based diet. And if you look at Marburg, it came from the bats. Ebola came from the bats. Nipah came from the bats. Then H5N1 influenza came from the chicken, and MERS came from the camel. And now pangolins and the bats are the culprit, which they have found out that how from the market of Wuhan it started. And these animals are animals we are domesticating since thousands of years. But these viruses like the AIDS, which has come from the chimpanzee, and it has become a big issue in our healthcare society. This has started because of animal farming, animal crowding, which is the issue. Earlier, also people were domesticating the animals, but now, how the story of the MERS is, before, if they say before 2012, when this MERS came, the animal farming, grazing of the camels was allowed in Dubai. They can graze outside. In 2011, they stopped the grazing of the camels outside. Camels were kept in prisons where overcrowding of camels happened, and the MERS started from the saliva of the camel. And there's a big campaign by the camel industry they told that they started a campaign that you kiss your camel, rather than when people told that don't go near the camel. So there was a big fight if you look at how it started in the MERS. So this is actually, if this world is on whole food plant-based diet, there would not have been any pandemic. There would not have been many calamities which have come. Like in Kerala, I did my research repeatedly. Now you see that because of the animal food intake, which is very high in Kerala, you are now getting repeated every year. You are getting almost floods. There was a big flood outbreak in last year. And the message is not only prevention, that you can, means this pandemics only start because of non-veg intake and animal food intake. Animal farming is causing. So mortality in COVID is mostly in diabetics and heart disease and hypertension people. And I'm taking repeated seminars since years and years, which are free to be watched on the Facebook, the how to reverse diabetes, how to reverse hypertension and heart disease. In all my seminars, which you were also there, I have given the reference of, I think in the diabetes, my seminar, I have given the reference around 350 journals, which are proving that whole food plant-based diet reverses your diabetes 100% of the times in type 2 diabetes and arrests your LADA and type 1. And around 228 journals I have mentioned in the hypertension and heart disease reversal program, that around 80% of the times you can reverse your heart disease, and around 50 to 60% of the times you can reverse your hypertension. So I think if simply we just change our diet, the greenhouse goes off, the global warming goes off. Global warming is causing big problem. All the floods, all the tsunamis can be prevented. And this pandemic, I mean, this world is now suffering like anything because of one meal where the bat transferred its virus to pangolins, and that pangolin was eaten. I have the photo of that shop where that meal was eaten and from which it started. So means simply changing to whole food plant-based diet is the final solution. I mean, why this is kept hidden, I don't know, because it's all about the big industry game. It's all about the big milk industry, big pharma companies, and that nobody is interested how to promote this prevention. They all are interested in selling drugs. They are all interested in selling masks and things which makes money. So simple promotion of whole food plant-based diet can change the things.
Wonderful, really very good observation. This is the root cause need to be sorted out. There's a sentence that I read that it's really not about the animals, but it's how animals are kept that has changed.
In India also, if you see earlier, the cows were kept in the houses, but each house had one cow. They will worship the cow. The cow will not be given any oxytocin injections. And I have recently done a survey that in Iceland, in Iceland, if you see difference between Finland, India, and the Iceland. In Finland and India, we have cow breeds, we have dairy industry, we have a lot of diabetes. In Iceland, they from in 2006, they told to the world that no breed will come, no cow's breed will come in Iceland, and they eat a lot of cow's milk. Still, the rate of diabetes, rate of uh, cancers, and rate of autoimmune disease is very low in Iceland because they rear their animals in their houses. Everybody will keep the animal happy. They will respect the animal. This is something about means harming animals, means like crowding of the animals, which is causing the problem, and then using industrial breeds they are using, and then giving chemical injections to the animals. So this is what we should think about it.
Also, the two-thirds of the all the pharmaceutical medications are actually used for the livestock. This is what I heard about it.
Yes, all the livestock, because they are overcrowding. So now there is
Yeah.
hygiene is not there. They all will suffer from different disease. Means if you keep 10 people in one room and they are doing shit there and eating there, they will develop many diseases in 1 week. And they in a 100 yards area, they will keep around 1,000 chickens, and they will be fed tetracycline antibiotics daily in their food. And the bioamplification of that antibiotics happens when you start from the grasses to the animals, and then comes into the human beings, and then building up of the pesticides. This is all what is the problem. If this world was mostly focused on whole food plant-based diet, there must have been no COVID. And I'm recently going to take a seminar in this month only on COVID-19 and the future pandemic. My guess is next pandemic is on ready. Maybe
Chicken
in 2 years you are going to get one more pandemic if
from
people are
chicken,
not
I
going
think
to change
it will
to
come
whole
from
food
chicken.
plant-based diet.
Agree, totally.
It is
Uh,
pandemic has started. I am going to tell you, it is started in the USA, in the pigs. It has started,
Pigs,
and
okay,
that
good.
they have done in circulation journal. They have given that virus is only 2 spikes away from the mutation in the pigs, and it is going to jump to humans.
Hmm. So there is a very good statement that I usually use is that what is the food of your food? What is the food of your food? Even if you have, say, a potatoes, if that potatoes have been grown on a ground that has, heavily sprayed with pesticides and herbicides, then it's all going to go into our system. And the same goes for the dairy, and if the grass is also having a lot of pesticides, same goes for also all the animal agriculture, farmed animals. What have they eaten? That if surely I'm going to eat that directly, right?
Right, right,
Dr.
absolutely.
Arun, you want to share?
Sure. I mean, I think that's kind of a tough act to follow, Dr. Pramod and Dr. Pawan. Like, I mean, first of all, I think they made some excellent points. So just to kind of give you my 2 cents, I mean, I completely concur, right? I mean, this is not the first pandemic. It's not going to be the last. Unfortunately, with increasing interaction between humans and animals, and the nature of the relationship, I think it's more and more it's just a question of time before we get more and more. If you look at kind of the frequency of these pandemics, right? I mean, you had SARS, MERS, now you have COVID-19, and I mean, it's bound to happen. We are, and I think he very beautifully talked about factory farming. And here's the thing, like when you have huge numbers of animals in such a stressful environment, it lowers their immunity. It creates a breeding ground for novel viruses, etc., to kind of crop up. And the increasing interaction between humans and these animals, the jump is very, very easy to happen. So I mean, and we are traveling so much in today's day and age, it's very hard to isolate and prevent pandemics. The other point too that I kind of want to bring to attention is with the rapid deforestation that we have. I mean, we are getting exposed more and more to animals and pathogens that we never would have. Like, I mean, just I mean, we keep reading, and I mean, very few of us actually do something about the Amazon forest being deforested and all this stuff. So I mean, it's there are so many potential points of interaction between humans and animals, and in a not so congenial way. And it's this is just a question of when, not if. And I think that's an important point. Um, and hopefully, I mean, as a species, we realize that, hey, yes, just because we have a bigger brain doesn't mean, I mean, we kind of really have to use it astutely, and hopefully we learn from the lessons of COVID and all these multiple pandemics that have happened in the past. What can we do to change? I mean, I think, Dr. Paawan, very, I mean, he kind of just cut to the chase, said, hey, the whole world switches to a whole food plant-based diet, we're going to be much better off. Couldn't agree more. I think we need to take the repercussions of our actions a little bit more seriously. And I think every person, hopefully, that watches this does some introspection. Hey, am I doing what's right for me? I mean, it's a no-brainer. If you really think about it logically, it's better for me, it's better for my immediate environment, it's better for the world, it's better for other sentient beings. I mean, it really makes sense. Now, the other point that I want to touch upon is, all right, now we are still in the midst of a pandemic. Yes, do your social distancing, do your mask, make sure you're careful. If you have comorbid conditions, be more extra careful, etc. But I do believe, and I'm kind of curious to see what data comes out of Dr. Pramod Tripathi's research in terms of what diets to help. But the one thing that we do know, and we don't need to do more research for this, is that clearly when you are on a diet as we are talking about, which is a whole food, like plant-based diet or vegan diet, in other words, your risk of chronic diseases, right? I mean, obesity goes down, diabetes goes down, hypertension goes down, your risk of heart disease goes down. I mean, it's really a way of kind of disease proofing ourselves. So I mean, if you need more impetus to change, I think now is the time. And clearly, again, not to downplay the effect of exercise. I mean, people do need to be active. You need to go out, do this stuff. But I think, kind of going back in time, the father of medicine, Hippocrates, said it best, like, food is thy medicine. I mean, you really have to do what's right for you. And it's the simplest thing that we could do. COVID times, I mean, I do think we do need to be extra careful, work on your immunity, whether it's yoga or exercise, whatever you're doing, definitely do these consistently. Also, make sure you eat responsibly. And if you do have other comorbid conditions, working on your diet will definitely help with all your other comorbid conditions. So, I mean, I think moving forward, uh, you know, post pandemic, I think it's important that we don't forget the lessons that we learned from this. Definitely be more responsible for your health. There are lots of tools. I mean, it's really heartening to see, doctors like Dr. Pramod, Dr. Paawan, Dr. Rupa. I mean, you guys have taken the bull by the horns. You're like working on, really helping people change. I mean, I do it more on a one-on-one basis, not necessarily in seminars, but I'm so glad. I mean, would love to participate. And I'll give you my 2 cents, because we do whatever we do at a high-end level. It's really like it's a tertiary. It's like you've failed the first, second, third, and you ended up in a heart attack. Hey, I can help you. I can help relieve angina, but do understand that fancy therapies, we are not curing heart disease by putting in stents or bypass surgery. You have to do stuff that you can to prevent getting on the table in the first place. It is critical. I can't emphasize this enough. And trust me, I mean, coming from me, I mean, many times people are like, aren't you kind of speaking against your own interest? I tell people, put me out of business. That should be the goal. I mean, accidents still will happen, right? Unfortunately, we are there to help you, but you shouldn't bank on the fact that we have body shops to keep having accidents. Please, COVID or otherwise, take these as an opportunity, make responsible changes, take more responsibility, do this. Thank you, guys.
Very well said. And we have unfortunately created a culture which says there's a pill for every ill. And for last 40 years, we've been prescribing more and more drugs. Every time a patient comes to the clinic, how are you? Well, Any problem? No. Sugar is under control. But are you on medication? You're on medication, right? That's not being well. You're not healthy. But that is the kind of impression that they have, that everything is good when you take a pill, or when you, there'll be some magical pill or a vaccine also will come for some disease. Well, so that is why people are a bit lost and still waiting that some magical thing will happen. But isn't that's not the one which is straight on, is to get onto the plant-based diet, change your lifestyle, work on your stresses, and really look for the root cause, which is animal agriculture, and don't promote or do not consume any such products. Automatically, when you don't demand, the industry will go. I know in the US now dairy alternative industry has become very huge, and the dairy industry is going down every year, and some dairies are closing. That's a good news. So now this is the discussion we know is extremely important, but how do we take it mainstream? How do we get our colleagues to get interested in this, and at least start paying attention? We are not saying that you leave your profession. We integrate this new knowledge, the diet and lifestyle, along with already some allopathic support is required. It's fine, and then you can gradually reduce it. How do we inspire them? How do we? I know in the US there's a conference that happens in the month of September, where about 400-500 plant-based doctors gather, and then they discuss in California 2 or 3 days all the benefits of plant-based diet. I really visualize that same thing should happen in India, and we'll have some conferences where 500 doctors will gather to discuss about the benefits of plant-based diet now. Mainstream medicine doctor. So, Dr. Pramod, show us the way forward so that more and more doctors come along, and get into this, because there's no rocket science here, right?
Yeah, I mean, there's no rocket science there, but there is a method in the madness which needs to be decoded. What I would foresee changes happening. I mean, Dr. Rupa, and we've been watching things. So a lot more doctors are getting inspired, and that's very powerful because it's all about passion. One doctor passionate about reversal, one Dr. Arun, one Dr. Paawan, one Dr. Rupa, one Dr. Pramod. We have amazing powers by which we can channelize them and make changes. So just to give an example, like what can be done, two three things. One is mass level initiatives. They are very very important. This talk which is going on, which will inspire people. People need to get a taste of success. So this year we have innovated something which we started last year in a small manner called the 30-day diabetes reversal challenge. Okay, so every day morning 7:30 to 8 people gather and we do half an hour of power packed energy transfer exercise, and people do share that within 7 days there are at least like somebody from Pakistan, somebody from Cuttack, somebody from different parts of the country, they are sharing during that particular session while we're doing exercise. Okay, I've become free, my fasting has come down, blah blah blah. And when people gather in large numbers, because online is going to be the way where we can gather people in large numbers. It's going to be difficult to gather them physically for, I think, a while. So mega online platforms where people gather, they do something together, meditate together, exercise together, share together. Okay, because that is very infectious for others. I feel one person who passed glucose tolerance test has the potential to inspire 1,000 others. 1,000 others, because he or she becomes a role model in their family, in their community, in their locality. People look at them, my God, 20 kg down, 15 kg down, looking so good. People get inspired by real results. And we need to be able to scale it up in a large way at the mass level. That's number one. Number two is publishing papers, publishing papers, publishing papers. We have to publish a lot more papers into the big journals, okay? And it's a big challenge to, when you're actually delivering the goods also, in terms of you're managing people. Dr. Pawan might be facing this while you're handling patients. How do we get time and energy to get into research papers and all that? So it's a big thing, but we need to publish papers and inspire the masses through a lot of online programs. And what do you say, tools whereby they can interact with each other, come to know the truth. The reality has to reach many more people. The reality has to reach. Social media needs to be used big time. Videos have to be used. We have to use all tools of marketing that way, I would say. Many times marketing gets a bad name, saying that, oh, this is marketed. So, no, 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 no. In fact, some of my batchmates, when they meet you, you're a great marketer, yaar. I mean, amazing you are doing, great marketing you done. And for the marketing, first the stuff needs to work. The product, the process needs to work. When Coke and Pepsi can be marketed and reach the masses, why can't good things be marketed? So we all have to learn marketing, I would say. Doctors have to need to learn marketing, need to learn how to reach the masses, need to learn how to publish papers. That's how mass level work is going to happen. Otherwise, we will all be contributing wonderfully in a few hundreds, a few thousands. But when we're looking at big change, we need to have big numbers. Our goal is 100,000 people becoming free. And it's going to be it's already a fun journey for us. And I also look forward to connecting with Dr. Arun, Dr. Paawan. Um, do share the numbers. I do want to kind of just have a to what talk of what else can be done together as we move
Sure.
forward. Together, yes, the energy becomes stronger.
That is
Together,
my
energy
aim,
becomes stronger.
to bring together all the medical doctors in India on one platform, and all of us, gather each every now and then and have our own interaction personally, and really become a very strong group ourselves. Very wonderful input. Very wonderful, really. Dr. Pawan?
Yeah, ma'am, sir is Pramodji is right that we have to create examples. We have to reverse people's diseases. We have to publish papers, and already a lot of research is there in the medical journals. We just need to see through the papers. Like for simply recently, I have launched a hypertension and heart disease reversal program, where I am building a data on hibiscus tea versus the enalapril and losartan. And to my surprise, now the research is already there that hibiscus tea is much more powerful than losartan and enalapril. But to crack that paper, we have to use. Then I was using SkyHub, and like in recently about this cholesterol and the antiplatelets ecosprin. The ecosprin resistance concept has come, and the research, one recent paper has compared head to head the raw garlic versus the ecosprin, and the results were fascinating. Then about the Indian gooseberry, which is the amla, they have I have the data. They have compared head to head pivastatin with uh, Indian gooseberry. Around 500 patients, they have done a randomized controlled trial, and the Indian gooseberry outpassed the pivastatin. Means in lowering the cholesterol, plus there was no side effect of the pivastatin in the Indian gooseberry. Means amla is something which is fascinating, and now I am using in my patients and keeping a follow-up. Only thing is the research of these papers will not be uh, shown to the people. Means it will not come to the doctors, it will not come to the mass media, because there is the industrial thing is which is pharmaceutical company, they will be showing only the research. So thing is, research is already there, are thousands and thousands of papers there on a whole food plant-based diet. Only thing is we need to reach those papers, we need to read them and then use them in our this thing. So but the main thing is really that papers have to be published, which I think I should start
Did we just
now.
Right.
Great.
We just lost you
Thank
for
you.
a few seconds, but because of the internet, but we are back again. So, Dr. Arun, what would you like to say to the way forward? How do we get mainstream doctors and masses totally interested in this?
so I mean, I think first of all, this is a great platform. I mean, I think this is step number one, like, even getting people together and putting something like this, I think is fantastic. I completely agree with pretty much everything that I think Dr. Pramod had talked about earlier. I mean, there are, when you think about this, right? If you want to get people together, it's always it's good to build bridges. You need data. I mean, I do think there's good data on whole food plant-based stuff. It is very hard if, I mean, if let's say you want to get a publication in any jam, you want to randomize people, etc. It's going to be super challenging. And frankly, I think in today's day and age, it's probably unethical to randomize people to an unhealthy diet when we clearly know the benefits, and that's okay. But it is important that we still get good registry data. And so not everything needs to be an RCT. You can still do really good registry data. I also think you should use informatics and modern technology to kind of help get data. I mean, like now people can take their phone, take a picture, and technology and has gotten good enough that we should be able to like assimilate, like get quickly pull the data, make it easy so that we get large scale data on what patients eat, and then the various benefits of diet and lifestyle changes, etc. I also think we should start thinking more synergistically. I mean, here you have Dr. Pramod doing phenomenal work, you got Dr. Paswan doing I'm sorry, Dr. Pavan doing great work, and then you're doing great work there. And if we can kind of get these things together, I mean, form some kind of a consensus statement, say, hey, this is what we guys are recommending. I mean, yes, I'm sure there will be differences, in the nuances, but overall, I mean, I think we can have consensus statements, because I think that'll be good. I think Dr. Pramod also kind of hit the nail on the head. I mean, think about the marketing that a lot of people do in terms of when you're talking about, say, soda or cigarettes, whatever, right? I mean, now, yes, cigarettes have become uncool, but I mean, historically, if you think about the amount of money that is spent on, essentially advertising cigarettes versus public health expenditure. I mean, this is not just in India. I mean, this is a global issue. We are vastly outspent by, let us say, other industries. So we got to be smart about it. I mean, there is no way, you can outspend them. So how do we kind of counteract this? You kind of have to be clever about it. We have to work together. We have to come up with consensus stuff. We got to use technology. And frankly, the other thing that I'm always very cautious about, and yes, there are myriad reasons for why people need to be on a vegan diet, right? But I mean, the one thing that I usually tell people is, like, I have enough people that are talking about the environmental costs. I have enough people talking about the ethical factors, etc. So I'm going to try and keep this as scientific as possible, because I mean, there's no point in everyone saying the same thing. So we really, let's stick to the science, and I think if we can actually prove to people and try to build bridges with other doctors. I mean, I don't want to go out and tell fellow, let's say, cardiologists and saying, hey, what you're doing is bad. No, that's not the point. But do you know that there are lots of other things that we could be doing for our patients that will, because most people, like most doctors, got into medicine because they want to help people. And I think if we can, instead of like it being confrontational, if we can work collaboratively, I think it'll help, we will go a long way in actually building consensus.
Right on dot. A positive approach instead of criticizing. I always say integrated approach. So let's all work together. Earlier, I used to always feel that we are going against the tide, but now the tide has turned towards us actually, towards the vegan lifestyle, the plant-based lifestyle, and that has become more in the vogue now. People are getting very interested. So now it's our time. It's our time to speak up, uh, in the language that they understand, and then carry this forward. What do you all say, right? Yeah, since you all are
Absolutely.
muted, yeah, I can
No,
only see your thumbs up.
no. We, yeah, guys, let's just kind of get unmuted, and
Yeah,
I think we're towards the end of the
yeah.
symposium anyway.
So, yeah, it's just that, like, I definitely know that my colleagues will understand better if we tell them in the language that they understand. And
Right.
let's not criticize them, because we come from the same field. We know that everyone is victim of some information that is probably supplied by some marketing agency or some media that needs to be re-examined. So as Dr. Pramod said, we need to real become also good in marketing our results, and tell the stories properly. Such beautiful stories we have. And the That's the thing. Why shouldn't the whole world know about this whole thing? So that's wonderful. Thank you very much for spending your Sunday afternoon sharing wonderful thoughts. It's going to be a memorable recording for us. And I really, I'm very thankful that, we can, let this message go to the masses and the doctors.